Okay, guys, here we go. Continuing. Anticholinergics and antispasmodics. All right, so let's go to. Let's start with the overview. It says motility is the spontaneous but unconscious or involuntary movement of food through the GI tract. It says much of the discomfort of GI disease is caused by increased cramping or intestinal peristalsis. Abdominal cramping, bloating, and pain may be either due to acute minor illness associated with diarrhea or increased gas or increased or chronic disease such as ulcers or colitis. Okay, so 3 medications used to treat these problems. You can see this right here, highlighted. Okay, you have anticholinergics, antispasmodics, or antidiarrheals. Okay, so if you're looking at your PowerPoint, we are on slide number 9, slide number 9. Okay, it says anticholinergic drugs selectively block the neurotransmitter acetylcholine. You can see this section right here, from binding to its receptor in the nerve cells. Okay, so anticholinergics, they work to reduce GI tract spasms and intestinal motility. Gastric emptying is slowed with these patients on this medication. Okay, and it says neutralize, and neutralization is increased. Pancreatic secretions and fluid and electrolyte enzymes are also stopped. Okay. And then your antispasmodics are parasympatholytic drugs. You see this section here? It says act to reduce muscle spasms in the GI tract. Thus cramping, bloating, and diarrhea are reduced. Okay, and then our antidiarrheals reduce the fluid content of the stool and decrease peristalsis and motility of the intestinal tract. Sorry guys, had some advertisement pop up there. Okay, and it says they increase smooth muscle tone and diminish digestive secretions. Alright, let's go to the next page here. Alright, hold on guys, give me a second, I got advertisement popping up again. Alright, no thanks. We don't want to play Bubble Witch. Okay. Alright, we just covered the antispasmodics. Okay, let's go to the next page here. Taking a second here for it to load. There we go. Alright. I've been having issues with my internet, guys. Sorry. Alright. So, uses of these medications. Anticholinergics are traditionally used to treat GI tract spasms, intestinal motility, acid production, gastric motility, thus reducing pain. Okay, its use is for peptic ulcer, pylori spasms, biliary colic, hypermotility, irritable colon, and acute pancreatitis. Okay, and then your antidiarrheals are used to treat, like it says, nonspecific diarrhea or diarrhea caused by antibiotics. Okay, and they reduce fluid content of the stool, like we had talked about before, in decreasing peristalsis and motility of the intestinal tract. All right, so let's look at adverse reactions of these medications. All right. It says that the most common adverse reactions And these are your anticholinergics. Let's highlight this here. This is for anticholinergics. Okay, and it's usually because of high dosages are usually required. So with this, you're going to see rapid weak pulse, blurring vision, dysphagia, difficulty talking, dilation of pupils, drowsiness, excitation, photophobia, confusion, restlessness, staggering, talkativeness, rash primarily over the face, neck, upper trunk, flushing of the skin, constipation, dry mouth, urinary urgency, and so on. Okay. Your antidiarrheals, you see here, may cause tachycardia, dizziness, drowsiness, fatigue, headache, sedation, abdominal distension, dry mouth, and then even physical dependence. Some people will get to the point to where they feel they can't go to the bathroom unless they continue to use these medications again and again. You see this very common in elderly folk, where they say they can't use the restroom unless they're, taking something. All right. Drug interactions. Okay, if you're following along, we're on slide 12. Drug interactions. It says anticholinergics containing phenobarbital may decrease the effects of anticoagulants, requiring higher dosages of the anticoagulants. And it gives you a lot of interactions there for these medications. Okay, it says the newer GI stimulants may cause serious dysrhythmias when given with other drugs that inhibit cytochrome P450 and must be used with caution in these patients. Okay, so nursing implication, patient teachings, of course. Any previous GI history, any history of irregularity in their bowels. Okay, it says patients assess patients with diarrhea. When do they have it? How often is there pain associated with it? Try to get as much information as you can. Okay. In your planning, like we said, preparations with phenobarbital may be habit forming, so they should not be given to patients with history of addiction. Okay. And opiates like loperamide says may cause psychological or physical dependence in use in high dosages for long periods of time as well. Once again, these agents should not be used in patients. Oops, sorry, let's do this again. Let's see if we can highlight this. Here we go. These agents should not be used in patients with diarrhea caused by poisoning until the toxin has been removed from the GI system. Okay. Now, these medications may be given orally or parenterally. And it says all of the antidiarrheal agents are given orally. It says individual dosages, see right here, are determined by need. Dietary changes are usually part of the treatment plan. Okay, and then evaluation. It says long periods of diarrhea can cause dehydration and electrolyte imbalance. So make sure you assess, increase fluid intake, replace fluid lost to stool. And then patients taking Lomotil or laxatives and narcotics should be watched for signs of central nervous system depression. Okay, we're going to highlight this. You guys make sure you read over that. Okay. Go to the next page. Give it a second to load here. Alright guys, sorry, my internet's running really slow today. All right, guys, you know what? I'm going to send you this section right here, and then we'll pick up where we left off with the nursing implications and patient teachings for your anticholinergics and antispasmodics. Let me see if we can get a better connection to my internet here. Okay? Hold tight.